Hi, I'm Psychotherapy Cynthia. Today I would like to talk about the theoretic approach of Alfred Adler to the practice of psychotherapy. Adlerian therapy, fundamentally known as individual psychology, operates on the core assumption that humans are motivated by social relatedness rather than sexual or aggressive urges. This theoretical approach, as detailed by Corey, 2017, is inherently optimistic and goal-oriented, viewing the individual as a creative, responsible, and proactive agent who shapes their own destiny. Unlike deterministic models that see people as victims of their past, Adlerian theory suggests that while we cannot change our history, we can change the way we perceive and use those experiences to inform our present movement toward the future. The development of one's lifestyle or style of life is a central pillar of this approach. During the first 6 years of life, individuals interpret their experiences within the family constellation, noting their birth order and the specific dynamics between siblings and parents to create a cognitive blueprint. This blueprint includes private logic, which is the set of personal convictions and beliefs about self, others, and the world that guides an individual's behavior. In clinical settings, Barlow and Durand, 2018, note that psychological distress often arises when an individual's private logic is based on mistaken goals or exaggerated feelings of inferiority that prevent them from successfully navigating the universal life tasks of work, friendship, and intimacy. The therapeutic journey is structured into 4 distinct but overlapping phases that prioritize the client-therapist alliance. The first phase, establishing the relationship, focuses on creating a collaborative partnership where the therapist acts as a fellow traveler rather than a detached expert. In the second phase, the therapist conducts a comprehensive lifestyle assessment, using tools like early recollections to identify recurring themes of belonging and significance. By examining these vivid childhood memories, the therapist helps the client see how they currently organize their reality and where their basic mistakes, such as overgeneralizations or impossible goals for perfection, might be hindering their growth. As the process moves into the third phase, the therapist uses tentative interpretations to encourage self-understanding and insight. The goal here is not merely intellectual awareness, but a deeper realization of the purpose behind one's symptoms. For instance, a client might discover that their social anxiety serves the purpose of protecting them from a perceived risk of failure, thereby maintaining a fictional sense of superiority. Once this insight is established, the final phase of reorientation and re-education begins. In this stage, the client is encouraged to translate their new understanding into action, moving from a self-centered perspective to one characterized by Gemeinschaftsgefühl, or social interest. To facilitate this movement, Adlerian practitioners employ various creative techniques designed to build courage and social connectivity. The acting as if technique allows clients to rehearse new roles, effectively challenging their limiting beliefs by proving they can behave differently, even before they feel different. The push-button technique is used to teach emotional regulation, illustrating that clients can choose to focus on pleasant or unpleasant thoughts and thus influence their own affective states. Throughout all stages, the therapist utilizes encouragement as the primary therapeutic force, helping clients recognize their own strengths and the value of contributing to the common good. Ultimately, Adlerian therapy aims to help individuals replace self-defeating patterns with a lifestyle that balances personal fulfillment with a meaningful contribution to society. Now, let's talk about concepts of fictional finalism, the creative power of the self, and modern multicultural considerations. The architecture of the future. Fictional finalism. A sophisticated understanding of Adlerian theory requires moving beyond past experiences to examine what Adler called fictional finalism. This concept refers to an imagined central goal, a fictional image of perfection or security that an individual strives toward to overcome perceived inferiorities. For example, a client may unconsciously operate under the fiction that I am only safe if I'm liked by everyone, which then dictates every social interaction and decision they make. This goal is not a fixed destination, but a guiding self-ideal that provides the necessary direction for an individual's movement through life's challenges. The creative power of the individual. While many theories in abnormal psychology emphasize the weight of heredity or environmental stressors, Adlerians highlight the creative power of the self. In this view, humans are not merely passive recipients of their genetics or their upbringing. Instead, they are the architects of their own lives who use these raw materials to construct a unique lifestyle. This perspective is vital when integrating Adlerian theory with modern clinical practice, as it shifts the focus from what happened to the client to how the client has chosen to use what happened to create their current reality. It is this creative capacity that makes change possible, as clients realize they can reinterpret their past to build a more functional future. Cultural strengths and therapeutic limitations. In today's diverse clinical landscape, the Adlerian focus on social interest and social embeddedness makes it naturally suited for multicultural counseling. Because the theory examines the individual within their social and cultural context, it avoids the trap of viewing psychological distress in a vacuum. However, therapists must be mindful of the egalitarian relationship, a hallmark of Adlerian therapy, which may conflict with the expectations of clients from cultures that view the therapist as a high-authority expert. Practitioners must also distinguish between encouragement and praise, while praise can feel like a condescending evaluation of the person. Encouragement specifically acknowledges the client's effort and resilience, fostering a sense of internal competence rather than a reliance on external approval. Legacy and modern integration. Finally, it is essential to acknowledge that Adlerian theory is the precursor to many modern evidence-based practices. The emphasis on identifying and challenging basic mistakes in private logic is the direct ancestor of modern cognitive behavioral therapy, CBT. While the use of task setting to encourage behavioral changes in daily life predates contemporary behavioral activation, by framing Adlerian theory as a bridge between historical psychodynamics and modern cognitive social models, this script provides a comprehensive map for how these foundational ideas continue to shape effective psychotherapy in 2026.